Good afternoon, everyone. We are C1 Group 2B and we will demonstrate the necessary physical examination to differentiate sensorineural and conductive hearing loss and evaluate degree of hearing loss. First, to differentiate sensorineural from conductive hearing loss, we will demonstrate the tuning fork test, namely the Weber and Rin test. But before that, let's define some terms. Conductive hearing loss occurs when sound is impeded because of diseases of the external auditory canal or middle ear, while sensorineural hearing loss occurs when there is a problem with the cochlea or the neural structures of the auditory system. Now, let's proceed to the tuning fork test. For this test, we will use a tuning fork that vibrates between 250 and 800 Hz, and in our setting, the 512 Hz is usually used. It should have a broad base and a large surface area. The first test is the Weber test.
Okay, so good afternoon. I'm Valerie Liu. I'm a third-year medical student from UST. And today I'll be conducting some tests in order to evaluate your hearing loss. Is that okay with you?
Yes.
Okay, we'll start with the Weber test first.
Explain the procedure to the patient and obtain consent first. To start the Weber test, sit at the same level or slightly higher than the patient. Strike the tuning fork or pinch the tip and place it firmly against the midline of the skull, usually on the vertex or the forehead. The vibrations are transmitted by bone conduction to the cochlea. Ask the patient where the sound is heard, whether equally in both ears or there is lateralization. When the patient's hearing is normal, or if the patient has symmetrical hearing loss, the sound is equally loud in both ears. In a patient with unilateral conductive hearing loss, the sound will be louder in the affected ear. In a patient with unilateral sensorineural hearing loss, the sound is louder in the normal ear. Now, let's proceed with Rin test. This test compares air versus bone conduction in the same ear.
Okay, so now po, I'll proceed na po with the Rin test. Is that okay with you?
Yes, ma'am.
After explaining the procedure and obtaining consent, we can now proceed. To start, strike the tuning fork and place it firmly against the patient's mastoid process to note bone conduction. Instruct the patient to tell when the buzzing sound stops and note the duration. Then, immediately move the still vibrating tuning fork near the external auditory meatus of the patient to note air conduction. Again, instruct the patient to tell when the buzzing sound stops and note the duration. Compare the duration of the bone conduction versus that of air conduction. Repeat steps for the other ear. For the interpretation, in a normal or positive test, a tuning fork vibration is transmitted to the cochlea better by air conduction than by bone conduction and lasts at least 15 seconds longer. This is seen in healthy patients and those with sensorineural hearing loss. However, when conductive hearing loss is present, the sound is perceived as louder on the mastoid than outside the ear canal, meaning bone conduction is greater than air conduction, which is a negative Rin test. This figure shows the interpretation for results obtained from both the Weber and Rin test. For the next part, we will demonstrate the physical examinations to evaluate degree of hearing loss, namely the whispered voice test and finger rub test.
Okay, now we'll proceed to doing the whispered voice test and the finger rub test in order to assess the degree of your hearing loss. Okay, can we start?
Yes, ma'am.
Okay.
For the whispered voice test, the patient will be sitting down face forward, and the ear not being tested will be covered. During the test, the examiner will be standing behind the patient within 1 arm length and will be saying a number-letter sequence. The patient will be repeating the sequence back to the examiner. Repeat the steps for the other ear. For the expected findings, if all 3 numbers and letters are repeated correctly, the test is passed. If not repeated correctly, a second group of different numbers and letters is then whispered. Correctly repeating 3 out of the possible 6 letters and numbers is deemed a pass. Lastly, for the finger rub test, have the patient close their eyes and occlude 1 ear. The examiner will place their hand 6 inches from the patient's ear and will rub their fingers. The patient will confirm or deny if they hear the sound. Repeat the test for the other ear. A positive result is failure to identify the rub in at least 3 out of the 6 attempts. This is the end of our presentation. Thank you for your attention.